I think that I like the way you said that too. That was a gentle reminder of the that this
I don't
is.
think it was that gentle.
I wasn't.
We got to go back to it. So what do? Well, we don't come in the day we open and decide that we're just going to put the straw back on or put the water bottle back on and drop the pallet. You want to start managing the water before you get back to work. And how do you know if what you're doing is working? How do you know you don't have a bunch of bacteria in your system because of the shutdown? Well, you know it because you're going to monitor. Okay. Now I realize I'm doing this on behalf of a monitoring company. And I'm going to say that, now they won't like this, but there's lots of people out there that can do this and they're good. But, I just got to say that because I'm trying to keep myself kind of neutral here.
No, it's good. And actually, we love Loma Linda. We're friends with people out there.
Yeah, I know. You guys all know everybody. You all are a very friendly and collegial group in this business. So we know that. But I'm just saying, find somebody. And the testing can be done one of two ways. It can be done by sending the samples, getting a sample test kit, taking the test, and sending it off to the laboratory of your choice to have it done. And you can get it done by any water testing laboratory. But to be honest with you, I think going with someone who has the expertise in the field has a lot of advantages. First of all, if you got a positive result, they know what you got. And the problem is you send it to the state water lab, and they see this high levels of bacteria. You never know what they're going to do. If they see a bug they don't like, they may be in your office asking you to do something or to shut your office down. So, use somebody who knows what they're doing and then can give you the right kind of feedback on what they know from their experience can help you resolve the problem that continues to exist. So back to that, monitoring is really important. So what the CDC recommends, and again, follow manufacturers' instructions to shock the system. Now, what we talked about earlier, the things I described, that's static. That's the germicide residual. That's biofilm suppression or biofilm. It's not, maybe some degree of remediation. But the true remediation comes from shock. If you own a spa or a swimming pool, you already know all this. It's not a bit different. You have to keep that little floater in your spa to continually release the bromine, but periodically you got to throw the shock stuff in there to knock the biofilm out of the system. Once in a while, you need to change the filter, and this is all the same. The water lines are the same thing. So there are shock products in the marketplace. There's several of them. Bleach is the oldest one. I did a lot of research on bleach for one of the manufacturers, and it was their recommendation for many years. And at least one manufacturer still recommends diluted bleach. But if you choose to use it, remember, unless it's the manufacturer's recommendation, it's off-label use, and you bear full responsibility for any negative consequences, either to the equipment, to staff, or to patients. So do that with some degree of caution. But there are commercial products out there that will work for this purpose. Once you've shocked the system, run clean water to remove the shock agent. And I would not test immediately. I would wait a day and then test, at least overnight, and clean water, because then some of the bacteria are going to get literally shocked. They're still viable, but they're going to be in a state of, they're going to be stunned. And what you want to have is a clear, true picture of what it's like. And then use either the lab test that I just described, or you can purchase in-office tests. And there's two products in the marketplace. And I'll just say it. I mean, one of them is the Millipore HPC sampler, which you can get from various sources, some of the dental supply catalogs here. And then ProEdge markets one too. There's advantages to each. I think the one I'm plugging, Mike. I'll plug this. It's easier to read the ProEdge one because you get some color in the. But they're both fine. They're both excellent, and I'm not saying you got to pick one or the other. Pick the one that works best for you. But these can also be used, and you have to document. Once you've done it, you need to document. Keep documentation just like you would a sport test. Okay, by the name of the unit, when it was taken, what the results were, and you read it. Keep it in a little log. Okay. Now, the shock done. Once you've got below the CDC's 500 colony forming unit per milliliter recommended level of bacteria, you should be good to go. And by the way, you almost never see 500. The results tend to dichotomize. Mike, am I right? How many thousands?
Oh, that's very well. That's a good way to say it too.
They're either low. They're either 0 and onesie twosies, or they're thousands. And
Yes,
because the fact is these bacteria are not static, they're growing. And bacteria, as you may recall from your micro class, grow logarithmically. They don't grow arithmetically. So they grow faster than coronavirus cases. So they're doubling 20 Pseudomonas in distilled water can double every 20 minutes or duplicate themselves. Logarithmic growth every 20 minutes. That's the growth curve on. So the fact is you hardly ever catch them in that intermediate phase between 0 and 500. It's hard to catch them there. It's lightning in a bottle.
97% of our tests are either close to 0 or dramatic failures. Not dramatic, but bigger numbers.
Yeah. So that's why it's a good test. And the number, by the way, and I'm just going to reiterate this because I have to keep reiterating it. That number 500 is not a magic number. First of all, heterotrophic plate count counts a very small percentage of the bacteria that are probably present in water. But it is the standard that's been used for drinking water going back literally, you're going to believe this, till the 1850s. It was originally developed by Robert Koch, the guy, you remember from micro, the guy of Koch's postulate?
Yeah.
He was a contemporary of Pasteur. He developed the first heterotrophic plate count. So that's how old this test is.
We dance around this a little bit, but that 500 CFU standard, how would you answer the question? I mean, if I pass that test, my water is safe. Is that fair?
If you're past that test, we couldn't recover the heterotrophic plate count organism to your system. If you had you won't, but if you had a monoculture of some weird biofilm bug, say you couldn't possibly get a monoculture of Legionnaires, okay, but it won't grow on the media. It won't grow in these media we're using. So you don't see any Legionnaires on these heterotrophic plate count media, R2A. So if that's what you had, you would never know it. But you aren't going to have that. And if the heterotrophic plate count bacteria, which are the basic building blocks of a biofilm, if they aren't present in low numbers, are suppressed, okay, so they may be there, but just massively suppressed by whatever the chemical you're using to treat it. Your water is probably safe enough. It's safe enough to drink. It's probably safe enough to use. And again, foot stomp for all non-surgical procedures. Surgical procedures, there's no wiggle room here. Yeah. If you're doing surgery, you need to be using sterile water. You shouldn't be using water from a restorative handpiece. You shouldn't be using water from an air water syringe. And that's a never. That's a never event.
Yeah.
So as far as I'm concerned, now a lot of people will look at me and roll their eyes. Fine, roll. But when something goes wrong, it's an indefensible, medical legally indefensible position to be in. Okay? I just want to let you know.
No, I think that I like the way you said that too. That was a gentle reminder of that.
I don't think it was that gentle.
I was.